Hello everyone and welcome to today's 1-800-RESPECT and ANROWS webinar. Today's topic is engaging practitioners. We are pleased to welcome our presenter for today, Heather Nancarrow, CEO of Australia's National Research Organisation for Women's Safety. ANROWS aims to build evidence on violence against women and their children. Heather has 30 years' experience working on the prevention of violence against women, including direct service provision, policy and legislation, and research and professional development. Heather has held many leadership roles at both the state and national level in regard to policy on the prevention of violence against women. This includes Deputy Chair of the National Council to Reduce Violence Against Women and current Co-Deputy Chair of the COAG Advisory Panel to Reduce Violence Against Women. Please note, this webinar is live and interactive. You are encouraged to participate by posing questions to Heather, which can be typed into the chat box, which is located at the bottom left-hand side of your screen. There will be approximately 20 minutes during the webinar for question and answer time. Heather will attempt to answer as many of these questions as possible during the webinar, including some pre-submitted questions. Should your question not be answered during the webinar, ANROWS is very happy to be contacted directly after the webinar. If you're experiencing difficulty hearing the sound during the webinar, please dial the 1-800 support number listed in the chat box. I'd now like to pass you over to Heather to begin.
Thank you very much, Kelly. Could I first begin by acknowledging that we're meeting today on the ancestral lands of Aboriginal people across Australia. I pay my respects to their elders past, present and future. I'd also like to acknowledge 1-800-RESPECT and thank you for the opportunity for this joint webinar, and to all of the people who are online and who've registered for this webinar, thank you for joining us and giving me the opportunity to speak with you directly about the work of ANROWS, and specifically today to talk with you about our Practitioners Engagement Group, but equally important other opportunities that there are for practitioners across the country to engage with ANROWS staff and with the work of ANROWS more generally. So in the presentation today I'm going to cover a number of matters. So first of all, I thought it might be useful for those of you who are less familiar with ANROWS to talk a bit first of all about who we are and what we do. I'd like to focus on how practitioners can get involved with our work. And I then will announce the 2015-2016 Practitioner Engagement Group. This will be followed by the question and answer section of the webinar, and I'd like to thank those people who've already submitted questions, and there will be a further opportunity to submit questions, and I hope that we can get to them all. And as Kelly said, if you aren't able to have your question answered during the webinar, then certainly contact us at inquiries@anrows.org.au and we'd be very happy to respond. ANROWS is a not-for-profit, proudly independent national research organisation. It's an initiative under the Council of Australian Government's National Plan to Reduce Violence Against Women and Their Children, 2010-2022, the National Plan, and it's funded jointly by the Commonwealth and all state and territory governments of Australia. I'd like to acknowledge that funding and thank the funders for it, because without that contribution, very substantial contribution from the Commonwealth and all of the states and territories, we wouldn't be able to do the work that we do, and the work that we do is important to contribute to the implementation of the National Plan. ANROWS governance structure includes the company members. So as the primary funders of ANROWS, the Commonwealth Government and every state and territory of Australia is a member of the company. If you like, they are the shareholders and have a stake in what it is that we produce with the funding that we receive through our core grant from all of those jurisdictions. However, as I said, we're proudly independent. We're a not-for-profit company and we're operated under a board of directors. There are 6 independent directors, including the chair, Emeritus Professor Anne Edwards. And then there are 4 government directors. So one of those is the Commonwealth Government appointed director, and there are 3 state and territory appointed directors, and they rotate every 2 years. Currently, the states and territories with a director on the ANROWS board are Queensland, Western Australia and the Northern Territory. This is the second group of state and territory directors on the ANROWS board. The first three were Victoria, New South Wales and South Australia. So the current three state and territory directors were appointed in February 2015 and their current terms will expire in February 2017. Our purpose is to lead national efforts to enhance the evidence base on domestic violence and sexual assault across research, education and service delivery organisations to support the national plan. We focus on translating evidence to resource policy development and service delivery responses. And we also aim to influence the broader national research agenda across affiliated areas. So one of the first tasks of ANROWS, when it was called the National Centre of Excellence to Reduce Violence Against Women and Their Children, was to develop the national research agenda to reduce violence against women and their children. And that national research agenda belongs to the whole country. ANROWS delivered it on behalf of the Commonwealth and state and territory governments, and it's what has been identified by the field, including policymakers, researchers and practitioners, as being the definitive agenda for violence against women and their children research in Australia for the next 3 to 5 years. Part of my role is to promote awareness of the national research agenda to other researchers and research organisations, including funding bodies such as the Australian Research Council and the National Health and Medical Research Council. The chair of the board and myself have met with the CEOs of numerous research organisations, including the ARC and the NHMRC, to bring to their attention the National Research Agenda to reduce violence against women and their children, and also to highlight that ANROWS, whilst it has a critical role in research on violence against women and their children, doesn't have sufficient research resources to do all of the research that's required, and therefore the responsibility remains with those major funding bodies to continue to fund the important research on violence against women and their children. And we certainly recommend that their research efforts fit within the national research agenda that has come from the field. And particularly policymakers and practitioners have identified that these are the information needs that they have for the next 3 to 5 years to inform their work. So as I said, we have a focus on translating evidence to resource policy development and service delivery responses. So we're a research organisation, but we recognise that it's not enough to produce evidence. In order to make a difference and to assist the field, and when I talk about the field, I'm talking very broadly about policymakers and practitioners in a wide range of organisations, that we need to assist those organisations to achieve the goals of the National Plan to Reduce Violence Against Women and Their Children. So the research that we undertake is building the evidence, but that's only part of the equation. The next step is, of course, to translate the research findings into resources that make the evidence accessible to policymakers and practitioners who are very busy and don't always have time to read and absorb complex research reports. So that translation, the knowledge translation and exchange work that we do is critical to the success of ANROWS and to the success of achieving the goals of the National Plan to Reduce Violence Against Women and Their Children. So we've developed an operating model that recognises 3 core functions, and these 3 core functions we conceptualise as our research effort. They are intersecting, as you can see from this diagram. The 3 core functions are knowledge production, knowledge translation and exchange, and leadership. So, of course, we are required to demonstrate leadership in regard to all of those functions, and as I indicated, in the development of the National Research Agenda and the promotion of the National Research Agenda to reduce violence against women and their children. So we see that ANROWS is part of a bigger effort under the National Plan to reduce violence against women and their children. Practitioners are a very important part of that, so are policymakers, but so are other researchers and research organisations beyond ANROWS. ANROWS has a current research program under our core grant, and that's the Research Program 2014 to 2016 Part 1. That research program was launched on the 31st of October in 2014. It has 20 projects within it, and they have a combined value of $3.5 million. Again, I can't overstate, I don't think it's possible to overstate how important it is that we've had the Commonwealth Government and all of the states and territories come to an agreement where they would pool resources for research and deliver that through to ANROWS so that we're able to undertake a research program of this magnitude. No single jurisdiction, I believe, would be able to fund a research program to the value of $3.5 million exclusively on research focused on violence against women and their children, and strategies to then communicate research findings to the sector to be able to advance or take up the evidence from the research and make strategic changes to the way that policy and programs are developed and practice is delivered to achieve the goals that we share. So again, I just wanted to acknowledge that funding and emphasise how important and valuable it is to have that national agreement and the national collaboration that we have in bringing ANROWS and its research program to fruition. ANROWS acknowledges and values the expertise of practitioners. When we talk about evidence, we see that evidence comes in a range of forms and from a range of sources, including the knowledge that practitioners hold. Practice wisdom is essential to our knowledge production efforts, and we value the work that you do and the input that you have to our work and the support that you provide to various research programs under our national program of research. Currently, within the 20 projects that I've mentioned as part of our research program part 1, there are 11 projects in which practitioners and advocates are research partners. So that's more than half of the research projects, in fact, have direct practitioner input into the development of the research, the development implementation of the research effort. So I think that is significant recognition, not only by ANROWS, but also by the research community, of the value of practitioner wisdom. And I'm very grateful to have your input into that. ANROWS has a networking database and on its website, and this networking database was developed to facilitate practitioner involvement in ANROWS research. And in fact, some of the research projects and researchers and practitioners have found each other through our networking database, and I'd encourage you, if you are interested in contributing to research, to register on the ANROWS networking database so that you are able to be identified as somebody with a research interest, and that you're able to, that researchers can, in looking for research partners, can identify you and your particular research expertise and be able to make contact with you in order to develop further collaborations into the future. So the ANROWS networking database, as I mentioned, can be accessed on our website. So here's a screenshot. I'm not sure quite how clear it is for you, but certainly if you go to the ANROWS website and look for the networking database, you'll be able to access that screen and be able to register on that and have your details there for potential further future collaboration with researchers on ANROWS projects. There are other ways that you can be involved too, that not necessarily directly involved in our research program or research delivery, but ANROWS has a number of publications, and if you haven't subscribed already to ANROWS, I'd encourage you to do that. We have a fortnightly publication called ANROWS Notepad, and that is it will come directly into your inbox if you're subscribed to ANROWS. It provides a snapshot of activities over the last fortnight from ANROWS, as well as information about events, new research, and information about issues relevant to violence against women and their children that have been in the news within the last fortnight. We also have a quarterly publication called Footprints, and with Notepad and Footprints, practitioners are welcome to contribute to those. If you have something that you'd like to contribute, then I'd encourage you to contact us via inquiries at anrows.org.au, and that your email will be received by Jess Gregory, who's our Jess is our Communications and Media Officer and looks after these publications, and Jess would be very happy to discuss with you potential contributions to Notepad and to footprints. There are a number of other publications that you will be able to access through our website, and again, if you're subscribed to ANROWS website, you will, or through the ANROWS website, then you will receive email alerts about new publications on our website, such as ANROWS Landscapes, and later on, when we have results of full research, there will be ANROWS Horizons, which are research reports. We currently have some ANROWS Insights, which are internal, in-house kind of papers or documents. And ANROWS Compass is the publication that does the work of translating the complex research reports to direction to, we call it Compass because it's about giving direction to policymakers and practitioners about what does all this mean for our work. So the ANROWS Compass, ANROWS Horizons and ANROWS Compass will be delivered as our research program comes to fruition. Within the next week or so, we will have 7 ANROWS Landscapes on the website. So we're furiously copy editing and having designed and typeset a number of publications that will be available very soon, and it's very exciting that these are the first lot of publications from the ANROWS Research Program that will be available very soon. So the ANROWS Landscapes are essentially state of knowledge papers, and we call them state of knowledge papers rather than literature reviews, because a literature review I think people tend to think of as traditionally reviews of peer-reviewed literature, and as I said, we acknowledge and value practice wisdom, and therefore a state of knowledge paper may include evidence from practitioners that, and certainly publications that that may be from community-based organisations or from government departments that don't appear in the peer-reviewed literature, but we recognise the importance of that material for the current state of knowledge on any particular topic within the violence against women field. So the landscapes state of knowledge papers are really important and in many cases, in most cases in fact, the first stage of research projects. So under the 20 projects within the ANROWS Research Program 2014-2016, there are 16 projects that will deliver a landscapes state of knowledge paper, and they will also deliver a research report called ANROWS Horizons and also the Compass. There are 4 projects which are the state of knowledge paper, and so, you know, they're smaller projects, of course, but the majority of the projects within our research program will have 3 deliverables, and you know, it's quite a different approach, I guess, to producing research evidence and presenting that. And here I would like particularly to acknowledge the research teams which are delivering those 3 stages, in most cases 3 separate deliverables. So as you can see, the way in which ANROWS works as a research organisation and a funder of research effort is unusual and innovative, I think. So, and I think that's the need for innovation in our field is obvious, and we couldn't be as innovative as we are and we wish to be without the support and collaboration of the research community, policymakers and practitioners. The other way that policymakers and practitioners get involved with ANROWS too is through peer review and advisory group mechanisms. So a number of practitioners as well as policymakers are peer reviewers for our research publications. And participate in advisory groups as well. So there are numerous ways apart from the Practitioners Engagement Group that practitioners can in fact get involved with ANROWS and get involved and support our work. We also have a resources database, so this is more of a resource for people working in the field where there's available information, and again it's not limited to peer-reviewed journal articles, but certainly includes that. But a wide range of material is available on our resources database, and we'll soon have available special collections. I'd also like to mention that we have events. So this is among the first. I did do a webinar with AFES last year, but this is certainly in this year the first webinar that we've done, and the first opportunity I've had to speak directly and specifically with practitioners. But we'll have a number of events. We had Liz Kelly earlier this year, and we've got Professor Lee Goodmark presenting public lectures in Sydney and Melbourne, and there will be details available on our website about those shortly. In February next year, the 23rd to 25th of February, we'll convene the ANROWS National Research Conference at the Grand Hyatt in Melbourne, and that will present the research to date from the ANROWS Research Program 214-216, and we will also be inviting abstracts from people who are undertaking research under the National Research Agenda to reduce violence against women and their children. That's beyond the ANROWS program. So any research that's being done elsewhere or funded by other research organisations that isn't ANROWS, we will be inviting them to participate in the research conference as well. So our role in terms of knowledge translation and exchange is to be a bridge between research, policy and practice. This is we need to have an ongoing collaboration between researchers, policymakers and practitioners. And as I've said previously, stakeholder engagement, including practitioner advice, is key to our knowledge translation and exchange functions. We already have a mechanism in place for engagement with senior officials. So across the country, we have a network of senior officials in the Commonwealth and state and territory governments, and we have a mechanism whereby we meet with senior officials on a quarterly basis. And to date, we haven't had a specific mechanism for practitioner engagement, although we've certainly been engaging with practitioners in various ways, but we felt it was important to establish a discrete and focused mechanism to provide some structure about the way in which we engage with you and you engage with us. But of course the Practitioner Engagement Group, the ANROWS PEG, we don't see as a way of limiting engagement. It's perhaps just to provide a mechanism that's equivalent to the mechanism that we have with our policymakers. We were absolutely thrilled to have received 94 expressions of interest to the 2015-2016 PEG, and of course we unfortunately weren't able to accept all 94 expressions of interest, so my sincere apologies to those who we've not been able to include in the PEG at this stage, but please don't be discouraged, because this is the membership of the PEG for 1 year, and we'll be calling for expressions of interest for the 2016-2017 PEG, subject to continued funding, around the same time next year. So we certainly see that and want to invite people to remain interested in membership of the PEG, even if you haven't made it onto the membership list on this occasion. And I would also encourage you to engage with ANROWS in the other ways that I've already outlined. So the PEG 215-216, I think I've probably covered these points in one way or another. It's to facilitate two-way knowledge sharing on practice and research. The membership includes representatives from the specialist women's services sector and others providing first point of contact services for women and their children. And we have representation from all states and territories across the country. In addition to representation from all states and territories, the Practitioner Engagement Group membership reflects the diversity within the Australian population. I'm very pleased to announce that the following people, whose names I probably won't read out, but you'll be able to read them as they scroll down the screen. And what we will do in this in the slide presentation is illustrate the various sectors or particular areas of expertise that these members of the ANROWS PEG 215 and 216 bring to the table. So these group of women, and maybe I will read, maybe I have got time to do this, but Aboriginal women with expertise on violence against women in Indigenous communities, Antoinette Braybrook, Mary Cowley, Dorinda Cox, Kylie Dowse and Shirley Slan, and you can see there that they come from different jurisdictions and two from regional parts of their respective states. Those with practice expertise specifically on working with culturally and linguistically diverse communities and violence against women, Maya Avdebegovic, I'm sorry Maya if I've pronounced your name incorrectly, Dr. Adele Madolo and Dr. Iman Sharabim. Representing Peaks and Networks, Dr. Garvey Ansara, Kelly Bannister, Moo Balch, Caroline Framada, Alison McDonald, Di Mangan, Jo Sheehan Patterson and Liz Snell. Those representing Specialist Sexual Assault Services are Lynn Berger, Samantha Bowden, Jackie Burke and Alison Fonseca. Specialist Domestic and Family Violence Services are Ruth Bamford, Jude Marshall and Rodney Vlay. Those representing the broader First Point of Contact services are Paula Mance, Jodie Sloan and Kylie Woodward. Those from the Specialist Women's Health sector are Dr. Alison Evans and Rhonda Garrard. And I don't know if you had time to count those, but I believe there are 30 people there. So again, apologies to the remaining members or interested practitioners who expressed interest in being a member of the PEG and are unable to be on that list at this point in time. Congratulations to those who are, and thank you to you all for expressing interest and wanting to reach out and support the work that we do at ANROWS. And I really sincerely thank you for that, and I look forward to working with you all, those particularly on the Practitioner Engagement Group through that mechanism, but all of you in one way or another over the next year. So thank you all, and I look forward to the questions. Yeah.
Hello everyone, my name is Jess. I'm just going to be reading out some questions for Heather. So we have a few questions that have come in ahead of the webinar, but if you have a question that you'd like to ask today, please use the chat box on the left-hand side. You're more than welcome to submit a question now. So our first question, Heather, is in the area of practitioner engagement. And so the question is, what are the opportunities for practitioners to be involved in research in their field?
Okay, well, I think I've probably answered that question during the presentation, but happy to summarise it again briefly here. So if you're interested in contributing to research, I'd very strongly encourage you to register on the networking database on the ANROWS website, and that way it will ask for information about your particular area of expertise and interest, and that will enable researchers who are also looking for partnerships to identify you, or you to be able to identify researchers that you might approach to express interest in collaboration on research projects into the future.
That's great. Thanks, Heather. Our next question is, what existing governance and leadership mechanisms will ANROWS leverage in this innovative practitioner engagement work?
Okay, so again, I think I've mentioned this in the presentation of the PEG membership, but just to reiterate that there are people from representing the diversity of organisations and other aspects of the Australian community, but in particular we have representation from peaks and networks. So I think that's the biggest single category, in fact, of membership within the PEG, and those people will be able to assist with communicating between and with ANROWS, to their membership and from their membership back to ANROWS, so that will, I suppose, maximise the number of people who will be able to hear through those network and peak body representatives about our work and be able to contribute to us and inform us as we go forward in our work.
Great, thanks Heather. Our next question relates to regional, rural and remote communities. So the question is, how will regional differences be accommodated in any research undertaken by ANROWS?
That's a very good question. It's That's always a challenge for any research projects. Some of the research projects are explicitly focused on rural and regional communities. Other projects will include regional and rural perspectives as a focus within the research. Some won't necessarily do that at all. With any research project, you will find that there are limitations, and that good research always highlights, what the limitations of a particular methodology are. So it's basically a methodological question to some extent, and I think that we won't find all the answers we might like to have in any one piece of research, but certainly we do endeavour to have a spread of across the research program of the diversity, including geographic diversity of the Australian community. So, and I suppose the other aspect of limitations in terms of being able to be all-inclusive, and there are a number of limitations, as I've mentioned, but one is resourcing, and whilst $3.5 million in our world is a lot of money for a research program, it doesn't spread very far, very wide or very deeply when it comes to answering all of the research questions that we have. But certainly we'll continue to pay attention to geographic diversity as well as other diversity in the development of the research programs going forward.
Okay, our next question relates to perpetrators. Has any research been done on the effectiveness of working with perpetrators of domestic and family violence?
Okay, so in addition to the core grant, I've really focused on the core grant funding that ANROWS has, that's funded collectively by the Commonwealth Government and all of the states and territories. In addition to that, the Commonwealth Government has provided to ANROWS $3 million for research on perpetrator interventions, and that research program is being developed. The reason it's not available yet is that there's significant work underway, but the purpose of that $3 million for the perpetrator intervention research stream is to support the implementation of the national outcome standards for perpetrator interventions. The national outcome standards are being negotiated between the Commonwealth and the states and territories. They're outcome standards for interventions, so they're not limited to perpetrator programs as such. They're interventions across the system, and the ANROWS team, our research manager and senior research officer for perpetrator interventions, is currently working on the ANROWS landscape state of knowledge paper on perpetrator interventions across Australia. So that paper will be available in within the next few months. It focuses on the current state of knowledge, including mapping of perpetrator interventions and a schema to identify the various philosophical underpinnings of various interventions across the country. So that's a fairly significant piece of work that's almost complete, but won't be available for some time yet. It's almost complete in terms of it being ready to go to peer review shortly. But you'd appreciate that there's some way to go after it has gone to peer review before it gets to be published. And the team is also working on the development of research priorities for that, and those research priorities will reflect what are considered priorities for implementation of the national outcome standards for perpetrator interventions. So at the moment we don't have a specific project on perpetrator interventions. That's a separate program that will come after the development of the national outcome standards for perpetrator interventions and the identification of an agreement on what the research priorities are, and then a process similar to the development of the core grant research program for engaging with researchers and practitioners around the implementation of a research program specifically on perpetrator interventions.
Thanks, Heather. Now we have a live question that has come in, so I might pose it to you now. Can practitioners in the community approach ANROWS PEG members with their research thoughts, or should we go directly to the ANROWS website?
I think that you could possibly do either. The ANROWS PEG hasn't met yet, so the people who had expressed interest were only informed yesterday of the outcome of our process for determining who would form the membership of the inaugural PEG. So I don't want to speak for the PEG members just yet about how they might like to engage directly, but if you have a question or comment or suggestion right now, please feel free to contact ANROWS directly, but we will get back to you in terms of the way in which the PEG is going to engage with practitioners within their local area. But I would have thought that particularly those who have been nominated by their peak body or network would be willing and able to take comment on board from practitioners, since they are representative of those peak bodies and networks. So I think either is okay.
Great, thank you, Heather. And I'll just quickly add that some more information about the PEG members is currently available on our website. Oh, yeah. It's been put up since we started the webinar, so you're very welcome to have a look. There. Now, our next question relates to domestic and family violence and children. It's a broader research question, which perhaps you'd like to delve into, Heather. What does the current research on the links between family violence and child abuse and child protection involvement or out-of-home care placement tell us?
Well, that's a very big question, and in fact we've got a project underway being conducted by a research team led by Professor Cathy Humphreys that I think will be a very important piece of research, as with all of the projects under our research program. And I wouldn't like to preempt what that research team finds, so I'm not going to answer in any detail what that question. It's a very important question, and it's a very important area for investigation, which was recognised in the ANROWS Research Program 2014-2016, and we'll be delighted to share the results of that research project with you as they become available.
Brilliant, thank you, Heather. Our last pre-submitted question is: do you think it is important to correctly position ourselves in understanding what drives the perpetuation of domestic violence terrorism?
Yep, of course. Yeah, I absolutely agree that it's critical that we understand the antecedents of violence against women. We certainly do in our research program. We recognise that domestic family and sexual violence share antecedents. We need to be not only addressing attitudes and behaviours, but also structural causes or the conditions that contribute to the perpetuation of violence against women and their children. We are working in collaboration with Our Watch and Vic Health to develop the national framework for primary prevention on violence against women. So we certainly recognising the importance of primary prevention, and primary prevention includes structural change. I might add that it's, in our context, in the Australian context as a colonised country, that we not only need to pay attention to gender inequality, but we also need to pay attention to racial inequality and the intersections of inequality in other areas as well. So it's a complex set of conditions that perpetuate violence against women and their children, but I absolutely agree that we do need to position ourselves to address those structural issues, as well as develop responses that are more effective responses to violence against women and their children through the evidence that we build.
Great, thank you, Heather. We have a live question that has come through. Hang on a minute, I've just got to scroll back. Experience, confidence and know-how are obstacles for practitioner involvement in research. Wondering if you are or have considered any training, guidance, working groups or mentor programs that might build practitioner involvement into research?
Thank you for that question. That's a great one. We do at ANROWS, as part of our leadership function, recognise the important role we can play in research capacity building, and we will be reviewing, we have been monitoring as we go, our research management system, how it aligns with achieving the goals that we have in our various functions, and we are very keen to investigate ways that we can support and assist the development of research skills from a wider range of people, including practitioners and policymakers and others, and we do want to enhance the availability of research skills across the whole country, and certainly recognise the, as I've said previously, the value of practitioners' input into research and knowledge production. So thank you for that question, and it's something that we are paying attention to, and we will be paying further attention to. And if you have any suggestions how we might do that, please let us know.
Now this might be our last question, Heather. You have mentioned advocacy with governments. How important is advocacy with governments within the research agenda and within your strategic planning?
Sorry, can you just repeat, how important is advocacy with
governments within the research agenda and your strategic planning?
Well, it's absolutely critical. Well, in the same way it's critical that we are advocating to practitioners and want practitioners to be advocating to us. What are the information needs? What are the knowledge translation exchange activities we ought to be doing to assist you in your work? Equally, that's important with governments, and we do that through our regular contact and our quarterly teleconference with senior officials, and we have other mechanisms as well, including regular contact with relevant ministers in states and territories, opportunities for collaboration with them on priorities within their jurisdictions, using the evidence that we have available to us to share with them and support the work that they're doing. We can't, I mean, the national plan, in fact, the time for action, the plan of the National Council to reduce violence against women and their children, recognise that we can't make the significant reduction in the prevalence of violence against women and their children by 2022 that we want to, unless we are all working together and in ways that is informed by evidence of what works best, or what we ought to be doing more of, and what perhaps we need to be doing less of. So advocating to government is critical from my perspective, because if in the same way as the practitioners, if we have evidence, there's no point at just sitting on a website or being held by ANROWS. We need to be able to translate that evidence into policy and practice, and it's absolutely critical that we're advocating that to government. But also, governments have invested in ANROWS. I mean, governments have funded ANROWS for that purpose. So in some ways, it's a two-way street as well as with the PEG. So it's really, I mean, I think we are in a position where we're working very collaboratively with government and with practitioners, but as we must, because none of us can achieve what we need to achieve and what we want to achieve without the other.
That's great. Thank you, Heather. That's all the time we have for questions today, so I might let you wrap up.
Okay, well, I don't know that there was a lot more I wanted to say, except thanks, Jess, for and the 1-800-RESPECT, Naomi and others who've been involved in organising this, and thanks to Jess for reminding me that for those of you who are interested to see more details about the membership of the PEG, when we didn't have time, or the slides couldn't really accommodate all the amazing details of the people who were who are now on the PEG. the details will be available on our website. In fact, they're there now. If you wanted to go and have a look after the webinar, you'll be able to get more of a sense of the breadth and the depth of expertise that the members of the PEG have. So once again, thank you to everybody who expressed interest, and congratulations to those of you who are on the PEG and with whom we'll be working more closely. But as I said earlier, I look forward to working with all of you in one way or another. And just to reiterate that if you want to get involved, this slide shows you the number of ways in which you can be involved with the ANROWS work, and look out for the expression of interest in 2016-2017 if you're interested in contributing through the PEG in the future. So thank you, and thank you for the opportunity to speak with you today.
Well, great. Thank you, Heather, for your presentation today, and thank you to everyone for attending today's webinar. A special thank you for everyone that submitted questions. Again, if you have any further questions or you missed out on having your submitted question answered during the webinar, please contact ANROWS directly. Finally, I'd like to take this opportunity to bring your attention to our next very exciting webinar with Megan Mitchell, the National Children's Commissioner, to be held on Wednesday the 12th of August. Join the Commissioner in this online forum examining how children are affected by domestic and family violence. This webinar will be a unique opportunity to have your say, participate in a discussion, or simply listen and learn. To find out more, visit 1800respect.org.au and visit the Frontline Workers portal. Please stay logged in to take our online survey, which you will be redirected to now. We thank you in advance for your participation, your questions and feedback, and wish you a pleasant afternoon.